Every day, we go about our lives, unaware of the incredible intricacies within our heads. But what happens when that harmony is disrupted by a simple, unforeseen impact? Join us on an eye-opening journey into the mesmerizing world of head injuries and their profound effects on the human experience. The immediate impact of a head injury is a complex and dynamic process that unfolds within the confines of the skull. When a head injury occurs, such as a blow or collision, it sets in motion a series of rapid physiological changes. One of the immediate consequences is disorientation. The individual who has suffered a head injury often experiences a profound sense of confusion and dizziness. The world around them may seem to blur as their brain momentarily struggles to process information effectively. In more severe cases, a head injury can lead to a temporary loss of consciousness. By causing the affected person to black out, the brain takes a pause, allowing it to recover and repair any damage sustained. The immune system is also activated in response to the injury, leading to an inflammatory process. Inflammation is a protective response, but when it becomes excessive or chronic, it can contribute to secondary brain damage. The blood-brain barrier, which typically regulates the entry of substances into the brain, can also become compromised by the impact. This barrier's disruption can allow potentially harmful molecules to enter the brain, further complicating the situation and potentially triggering additional inflammatory responses. Additionally, the impact can disrupt the brain's blood flow, affecting the delivery of oxygen and nutrients to brain cells. Reduced blood flow can lead to secondary brain damage, emphasizing the importance of swift medical evaluation and intervention. In some cases, a head injury can result in bleeding within the skull, a condition known as intracranial hemorrhage. This can exert pressure on the brain, which can lead to further complications and necessitates urgent medical attention. A concussion is a mild traumatic brain injury that disrupts the normal functioning of the brain. It typically results from rapid acceleration or deceleration of the head, causing the brain to move within the skull. This movement can lead to stretching and straining of brain cells and their delicate connections. The symptoms of a concussion can be wide-ranging. Physical symptoms may include headaches, dizziness, and sensitivity to light and noise. Cognitive symptoms can manifest as difficulties with concentration and memory. Emotionally, individuals may experience irritability, mood swings, or even symptoms resembling depression or anxiety. Sleep disturbances, such as insomnia or excessive drowsiness, can also be indicative of a concussion. What makes concussions particularly challenging is that symptoms may not always manifest immediately. In some cases, there may be a delayed onset of symptoms, making it essential to monitor individuals who have experienced head trauma for an extended period. Concussions are not just a short-term concern. They can have lasting effects on an individual's cognitive function and emotional well-being. Recognizing and properly managing concussions is crucial for recovery. Rest, both physical and cognitive, is a key component of treatment, allowing the brain time to heal. For individuals who are at risk of repeated head injuries, such as athletes or those in certain professions, it is vital to implement preventative measures, such as using protective equipment like helmets and adhering to safety guidelines. Delving into the long-term consequences of head injuries brings us face-to-face with chronic traumatic encephalopathy (CTE), a condition that has gained prominence due to its connection with repeated head trauma, especially in contact sports and military service. CTE is a neurodegenerative disease that emerges years or even decades after the initial injuries. It's characterized by the abnormal accumulation of tau protein in the brain, which forms tangles and disrupts normal cellular function. The symptoms of CTE can be severe and wide-ranging, encompassing cognitive impairment, mood disturbances, and behavioral changes. What makes CTE particularly alarming is its progressive nature. As the tau protein accumulates and spreads throughout the brain, the symptoms tend to worsen over time, often leading to a dramatic decline in an individual's overall quality of life. However, diagnosing CTE during life remains a significant challenge, as it typically requires post-mortem examination of the brain. This lack of a definitive, in-life diagnosis makes it even more essential to raise awareness about head injuries, promote prevention, and encourage ongoing research to better understand CTE and its risk factors. Recovery and rehabilitation are essential components of the journey to healing following a head injury. The brain, a remarkably adaptable organ, possesses the ability to re-establish neural connections and recover lost functions. After a head injury, an individual's path to recovery is highly individualized and depends on the severity of the injury and the specific areas of the brain affected. Physical therapy can help individuals regain motor skills, balance, and coordination, addressing physical impairments that may have resulted from the head injury. On the other hand, cognitive rehabilitation focuses on restoring cognitive functions like memory, attention, and problem-solving, which may have been compromised. While some individuals may experience a near-complete recovery, others may continue to manage lasting symptoms or challenges. The extent of recovery depends on several factors, including the type and severity of the head injury, the age of the individual, and the timeliness of intervention and rehabilitation. From the immediate impact to long-term consequences, the consequences of getting hit in the head are profound. Understanding the intricate processes involved not only helps us appreciate the brain's resilience but also highlights the importance of head injury prevention and the need for ongoing research to protect and preserve our most vital organ, the human brain.